So what about diet? If you go on the internet, which I'm sure everyone here has done at least once, and you typed in diet and IBD, you're going to come up with all sorts of things you can try and do. And we're interested in this. We're very interested in this. Unfortunately, we haven't found a good diet that does everything we need it to do yet. But I can promise you that if you decided to go gluten-free, you might feel a little bit better. But the difference between feeling better and actually controlling your disease is an important distinction you need to make. So we want people to feel better, don't get me wrong, but we also want to make sure that the disease itself is under control. And so we'll talk much more about that. We're doing a lot of research on diet. So here's an interesting study that the University of Chicago did just a couple years ago, and you see the title there, Western Diet Changes Gut Bacteria and Triggers Colitis in Those at Risk. Well, so there it goes. People think it's our diets. Where we live here in the United States and in Asia, where they're using westernized diets now. You might want to know, though, who was at risk, and in fact, it was mice. So does this translate to humans? Maybe. It's certainly an important observation. We have a whole bunch of mice in our labs that have IBD, poor mice, and mice that are susceptible to getting IBD, and we study them and try to figure all this out. So one of the things to keep in mind, though, is that even if we were to discover what causes a lot of IBD, it doesn't necessarily help us treat it differently at the current time. So that's a picture of a horse that's out of the barn. You get it, right? Okay, now the next big complicating feature is the microbiome. So you may have heard this term before. The microbiome refers to all the organisms that live in or on your body. So you have microbiome of your skin, you have microbiome of your nasal cavity, you have a microbiome of your gut, obviously, you have a microbiome of every part of your body. And there's a lot of research that's going on related to the microbiome. Part of that research is in a special facility at the University of Chicago, which is germ-free. So we take those mice that are susceptible to getting IBD, and we raise them in an environment where they have no organisms in their body, and they don't get colitis. Doesn't happen. The second we introduce the rest of the world into their environment, their colitis gets turned on. Well, that's an interesting experimental model, but of course that doesn't represent what happens to the rest of us. The rest of us, when we're born, we get exposed to the rest of the world and we get the bacteria into our guts. But it is a very important model, and the University of Chicago has one of the largest facilities like this where we can study these mice in the whole world. Now we might also be getting confused about the immune system. So here's a nice table that I got from one of my good colleagues and friends of all the different diseases that are actually due to immune defects that can look like IBD. So they're often mistakenly told that they have Crohn's disease, but there's this other problem going on where they have these other genetic abnormalities, like something called chronic granulomatous disease, which is due to a neutrophil defect, and some of the other rare ones that you see there. So it gets back to my very first comment tonight, which is you got to make sure that the diagnosis is accurate. But we can learn from this and say, you know, these immune problems also look like IBD, so maybe there's a clue here that some people with IBD actually have problems with these different immune problems. And what that would do, if we actually understood this a little bit more, is enable us to provide very specific therapies based on the defect itself. And in fact, in babies who get something that looks like Crohn's but actually have one of these problems, doing a bone marrow transplant for that specific genetic defect can cure them. So there's an example of a potential cure of what we called Crohn's, but in reality was a genetic abnormality related to one of these problems listed there.